Top 25 Home Health Aide Interview Questions and Answers. Home Health Aide interviews assess your caregiving skills, compassion, communication abilities, and commitment to providing quality care for clients in their homes. Employers want candidates who can assist with daily living activities, maintain patient dignity, and respond calmly in challenging situations. Preparing for common interview questions can boost your confidence and improve your chances of getting hired. In this guide, you'll find 25 frequently asked Home Health Aide interview questions with sample answers to help you impress hiring managers and secure your next caregiving role. 1. Tell me about yourself. I am a compassionate and dependable caregiver with a strong passion for helping people maintain their independence and quality of life. I enjoy building positive relationships with clients while assisting them with daily activities, personal care, and companionship. I am patient, attentive, and committed to following care plans carefully. My goal is always to provide safe, respectful, and reliable support while ensuring clients feel comfortable, valued, and treated with dignity in their own homes. 2. Why do you want to become a home health aide? I chose this career because I genuinely enjoy helping others and making a positive difference in their daily lives. Caring for seniors and individuals with disabilities gives me a sense of purpose and fulfillment. I appreciate the opportunity to provide emotional support, companionship, and practical assistance that improve someone's independence and well-being. Knowing my work can bring comfort, safety, and happiness to clients motivates me to perform my responsibilities with dedication every day. 3. What are the responsibilities of a home health aide? A home health aide assists clients with personal hygiene, bathing, dressing, grooming, meal preparation, medication reminders, light housekeeping, mobility assistance, and companionship. They also monitor clients for changes in health, document observations, and report concerns to supervisors or healthcare professionals. Maintaining confidentiality, ensuring safety, following individualized care plans, and treating clients with respect are essential responsibilities. The goal is to help clients remain comfortable, healthy, and independent within their homes. 4. How do you handle difficult or uncooperative clients? I remain calm, patient, and respectful when dealing with difficult clients. I try to understand the reason behind their behavior because discomfort, fear, or illness often causes frustration. I communicate in a gentle and reassuring manner while giving them time to express themselves. If necessary, I adjust my approach without arguing and follow the care plan. When concerns continue, I report the situation to my supervisor for additional guidance and support. 5. How would you respond if a client fell? If a client falls, I would first stay calm and ensure the area is safe. I would avoid moving the client unless they are in immediate danger, because movement could worsen injuries. I would check for signs of pain, bleeding, or unconsciousness, and call emergency services if necessary. Then I would notify my supervisor and the client's family according to policy. Finally, I would accurately document the incident and complete required reports. 6. How do you maintain patient confidentiality? I protect patient confidentiality by keeping all personal and medical information private. I only discuss client information with authorized healthcare professionals or supervisors involved in their care. I avoid sharing details with friends, family, or anyone without permission. I also follow HIPAA regulations and company policies regarding documentation and communication. Respecting confidentiality helps build trust, protects client privacy, and demonstrates professionalism in every caregiving situation I encounter. 7. How do you prioritize multiple caregiving tasks? I begin by identifying tasks based on urgency and the client's immediate health and safety needs. Essential responsibilities such as medication reminders, mobility assistance, and personal hygiene receive priority before less urgent household tasks. I stay organized by following the care plan and maintaining a schedule. If unexpected situations arise, I adapt quickly while ensuring all critical duties are completed. Good time management allows me to provide consistent, high-quality care throughout my shift. 8. How would you deal with an emergency medical situation? During a medical emergency, I stay calm and assess the client's condition immediately. If necessary, I call emergency services without delay and provide basic first aid or CPR if I am trained and it is appropriate. I follow emergency procedures established by my employer, notify my supervisor and the client's family, and carefully document the incident afterward. Remaining composed and acting quickly can significantly improve the client's safety and outcome. 9. Why should we hire you as a home health aide? You should hire me because I am compassionate, dependable, and committed to delivering excellent client care. I understand the importance of patience, empathy, and professionalism while assisting individuals with daily activities. I communicate effectively with clients, families, and healthcare teams while carefully following care plans and safety procedures. I am eager to learn, adapt to different situations, and consistently provide respectful, reliable support that enhances each client's comfort, independence, and quality of life. 10. How do you assist a client with personal hygiene while maintaining dignity? I always respect the client's privacy, preferences, and independence during personal care. Before assisting, I explain each step and ask for their permission. I use towels or blankets to provide privacy and encourage the client to do as much as they can independently. I remain patient, professional, and respectful throughout the process. My goal is to help clients feel comfortable, safe, and valued while maintaining their dignity and self-esteem during personal hygiene activities. 11. How do you communicate with clients who have hearing or speech difficulties? I communicate patiently by speaking clearly, maintaining eye contact, and using simple language. If the client has hearing difficulties, I ensure they can see my face and avoid speaking too quickly. For clients with speech challenges, I give them enough time to express themselves without interrupting. I also use written notes, gestures, or communication aids when necessary. Effective communication builds trust and ensures clients receive the care and attention they need. 12. What would you do if you notice changes in a client's condition? If I notice any physical, emotional, or behavioral changes in a client, I carefully observe and document the symptoms. I immediately report my observations to my supervisor or healthcare professional according to company procedures. I never ignore sudden changes because early reporting can prevent serious health complications. While waiting for further instructions, I continue monitoring the client closely and provide reassurance, ensuring their safety and comfort at all times.
13. How do you handle stressful situations at work? I stay calm by focusing on the client's immediate needs and following established care procedures. I prioritize tasks, communicate clearly, and avoid making rushed decisions. When challenges arise, I remain positive and seek guidance from my supervisor if needed. I also practice good time management and maintain a professional attitude throughout the day. Managing stress effectively helps me provide safe, compassionate, and consistent care even during demanding or unexpected situations. 14. Describe a time you solved a problem while caring for someone. While assisting a client, I noticed they were refusing meals because they found eating uncomfortable. I calmly discussed the issue and discovered they preferred softer foods. After informing the family and supervisor, meal options were adjusted to better suit the client's needs. Their appetite gradually improved, and they became more comfortable during meals. This experience taught me the importance of observation, communication, and finding practical solutions to improve client care. 15. How do you ensure client safety in the home? I regularly check the home for potential hazards, such as loose rugs, poor lighting, or cluttered walkways that could cause falls. I assist clients with mobility when needed and encourage the use of walkers or other assistive devices correctly. I follow infection control procedures, practice proper lifting techniques, and monitor clients for signs of illness or discomfort. Creating a safe environment helps prevent accidents and supports the client's independence and overall well-being. 16. What would you do if a client refused care? If a client refuses care, I remain respectful and avoid forcing them. I calmly ask why they are refusing and listen carefully to their concerns. Sometimes changing the timing or explaining the benefits helps resolve the situation. If the client continues refusing, I respect their decision while documenting the incident and informing my supervisor according to policy. Maintaining respect and open communication is essential for providing person-centered care and preserving trust. 17. How do you build trust with your clients? I build trust by treating every client with kindness, honesty, and respect. I arrive on time, keep my promises, and consistently provide reliable care. I listen carefully to their concerns, encourage open communication, and respect their personal preferences and privacy. Being patient, compassionate, and maintaining confidentiality helps clients feel comfortable and secure. Strong relationships based on trust improve cooperation and contribute to better physical and emotional well-being for each client. 18. How do you work with family members and healthcare professionals? I believe teamwork is essential for providing excellent client care. I communicate respectfully with family members and healthcare professionals, sharing important observations while maintaining confidentiality. I carefully follow care plans and report any changes in the client's condition promptly. I listen to feedback, ask questions when needed, and remain cooperative in achieving the client's healthcare goals. Strong collaboration ensures consistent, safe, and high-quality care for every individual. 19. How do you remind clients to take their medications? As a home health aide, I provide medication reminders according to the client's care plan, but I do not administer medication unless authorized by law and employer policy. I remind clients at the scheduled time, encourage them to take the correct medication, and observe for any unusual reactions. If I notice missed doses or side effects, I immediately report them to my supervisor or healthcare provider. Accurate documentation ensures continuity of care and client safety. 20. What qualities make a great home health aide? A great home health aide is compassionate, patient, dependable, and respectful. Strong communication skills help build trusting relationships with clients and families. Good observation skills allow caregivers to recognize changes in a client's condition quickly. Time management, flexibility, and professionalism are also essential for handling daily responsibilities efficiently. Above all, a successful home health aide genuinely cares about improving clients' quality of life while providing safe, reliable, and dignified personal care. 21. How do you handle clients with dementia or Alzheimer's disease? I care for clients with dementia by remaining patient, calm, and understanding. I communicate using simple, clear instructions and maintain a consistent routine to reduce confusion. I avoid arguing if the client becomes disoriented and instead redirect the conversation gently. I closely monitor their safety, provide reassurance, and encourage familiar activities that promote comfort. Treating clients with empathy and respect helps reduce anxiety while maintaining their dignity and emotional well-being. 22. What would you do if you suspected elder abuse or neglect? If I suspected elder abuse or neglect, I would carefully observe the situation without making assumptions. I would document factual observations such as injuries, unsafe conditions, or unusual behavior. Following company policy, I would immediately report my concerns to my supervisor or the appropriate authorities. Protecting vulnerable clients is a professional responsibility, and reporting concerns promptly helps ensure their safety, well-being, and access to appropriate support and protection services. 23. How do you stay organized during your shift? I stay organized by reviewing the client's care plan before starting my shift and creating a priority list of tasks. I complete important caregiving duties first, while allowing flexibility for unexpected situations. I document completed tasks accurately and communicate any concerns promptly. Good time management, attention to detail, and maintaining a structured routine help me provide efficient, high-quality care, while ensuring every client receives the attention they deserve throughout the day. 24. What would you do if a family member disagreed with the care plan? If a family member disagreed with the care plan, I would listen respectfully to their concerns without becoming defensive. I would explain that my responsibility is to follow the approved care plan developed by healthcare professionals. I would encourage them to discuss their concerns with the nurse or supervisor so appropriate changes could be considered. Maintaining professionalism, clear communication, and respect helps resolve disagreements while ensuring the client's best interests remain the priority. 25. Where do you see yourself in 5 years? In 5 years, I hope to continue growing within the healthcare field by expanding my caregiving skills and earning additional certifications. I want to become an even more experienced home health aide who consistently provides exceptional care and support to clients. I am also interested in mentoring new caregivers and taking on greater responsibilities within the organization. My long-term goal is to build a rewarding career dedicated to improving the lives of others. Preparing for a home health aide interview is the key to demonstrating your compassion, professionalism, and commitment to quality patient care. By practicing these 25 common interview questions and answers, you'll be better prepared to communicate your caregiving skills, problem-solving abilities, and dedication to client safety and dignity. Employers value candidates who are dependable, empathetic, and eager to make a positive impact. Review these answers regularly, personalize them with your own experiences, and approach your interview with confidence to increase your chances of success.